Our face. It's one of the most basic ways we connect with the world, right? It shows joy, sadness, surprise, everything. But what happens if one day that connection is just gone? Today, we're going to break down the really unsettling but surprisingly common condition of facial nerve paralysis. Just try to imagine this for a second. You wake up, you stumble to the mirror, and you try to smile. But only one side of your mouth moves. You try to close your eyes, and one of them just stares back at you, wide open. It is a deeply scary and confusing experience. And the very first question that hits you is, what in the world is happening to me?
Okay, so let's get right into it. The most obvious thing, of course, is that part of your face is weak or frozen. But the thing is, the facial nerve does so much more than just move your smile around. The paralysis actually comes with this whole host of other really strange side effects.
And this is what really shows you how complex this nerve is. You might suddenly lose your sense of taste on one side of your tongue. Normal everyday sounds can become painfully loud. That's a condition called hyperacusis. You might get a super dry eye or a dry mouth because your tears and saliva just stop working right. And for a lot of people, the whole thing starts with this sharp pain right in or behind their ear.
So you have to wonder, why this nerve? I mean, of all the nerves in your head, why is the facial nerve so easy to knock out? Well, it all comes down to the crazy journey it takes to get from your brain to your face.
Think of it like a highway, a really long, winding highway that has to squeeze through this super narrow, bony tunnel inside your skull. Its path is so tight and complicated that any little bit of swelling or inflammation can just pinch it and shut the whole thing down. This vulnerability is the key to understanding why so many different things can go wrong with it. And that brings us to the detective work. When someone shows up with facial paralysis, doctors have to figure out which culprit is to blame. And believe me, there's a whole lineup of potential suspects. So while there are a bunch of different things that can cause this, one of them is way more common than all the others. And it's usually the first thing doctors suspect. Let's start with the big one, Bell's palsy. Bell's palsy is what doctors call a diagnosis of exclusion. All that means is they rule everything else out, and if they can't find any other reason for the paralysis, they label it Bell's palsy. We still don't know the exact cause, but it seems to be linked to viruses like the one that causes cold sores. And honestly, for patients, that mystery is often the most unsettling part of it all.
Okay, beyond Bell's palsy, you've got some specific infections that are major players. In certain parts of the country, Lyme disease from tick bites can actually cause up to a quarter of all facial palsy cases. Then there's something called Ramsay-Hunt syndrome. It's a nasty return of the chickenpox virus that also gives you a painful rash in your ear. And even a simple middle ear infection can sometimes spread and inflame that vulnerable nerve.
All right, the next major suspect on our list is physical trauma. In fact, because of that long exposed path we talked about, the facial nerve holds the really unfortunate title of being the most frequently injured cranial nerve. Any kind of head injury, especially a fracture to the bone on the side of your skull, puts that nerve in serious danger. And get this, the exact type of fracture makes a huge difference. A transverse fracture, one that cuts right across the bone, has a nearly 50-50 chance of causing paralysis. A longitudinal fracture, which runs along the bone, has a lower risk, but it's still a significant 1 in 5 chance. It just goes to show you how physically fragile that nerve situation is. And finally, we get to the less common, but obviously the most serious suspects. A tumor growing along the nerve's path can slowly squeeze it, causing paralysis that gets worse over time. And, crucially, a stroke happening up in the brain can also cause facial weakness. Figuring out if it's a stroke or one of these other things is job number 1 in the emergency room. So how do they do it? How can a doctor tell the difference between a stroke and something like Bell's palsy so quickly? Well, it turns out it all comes down to one brilliantly simple observation. So what is it? What's this crucial clue that separates a problem in the brain from a problem with the nerve itself? It's all about the forehead. Here it is, the forehead test. If the problem is central, like a stroke, the forehead actually gets nerve signals from both sides of the brain. So the person can still raise their eyebrows and wrinkle their forehead. The upper part of the face is spared. But if the problem is peripheral, meaning it's in the nerve itself, like with Bell's palsy, the whole signal is cut off. That person cannot wrinkle their forehead on that side. This one simple test is the most important first step in figuring out what's going on. So once a diagnosis is made, the focus immediately shifts to getting better. And the good news is, for most people, the outlook is actually surprisingly positive. Treatment usually follows a pretty clear path. First things first, if there's a specific cause, like Lyme disease, you hit it hard with antibiotics. For Bell's palsy and a lot of the other causes, the main treatment is corticosteroids, which are powerful anti-inflammatories to reduce that swelling on the nerve. And this last part is absolutely critical. You have to protect the eye. Since it can't blink, it can dry out and get damaged, so using artificial tears and even taping it shut at night is essential.
So, what are the odds of a full recovery? Well, it starts with this number.
71%. That is the percentage of people with Bell's palsy, again the most common cause, who make a full, complete recovery. Most people start to see big improvements within just a few weeks. So the key takeaway is, while it is incredibly scary when it happens, the prognosis is generally very, very good.
And what about for a stroke? Well, those numbers are also really encouraging.
About 2/3 of stroke patients either get all of their facial function back or are just left with some mild weakness after about 6 months. It's a really powerful reminder of just how incredible our bodies and our brains are at healing themselves. So you see, in the end, facial paralysis is way more than just a medical condition. It's this sudden, jarring interruption of our most basic way of connecting with other human beings. It really makes you think about how much of our identity is wrapped up in our expressions and what it really means to be seen by the world.